Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Insulin levels can provide us with a lot of information, especially about metabolic health of your patient. Conditions like diabetes, insulin resistance, and polycystic ovary syndrome are part of the group that insulin levels can help you determine. Typically, insulin levels should be measured after fasting from 8 to 12 hours, and this helps to establish a baseline level, and there's no interference of food in this particular type of assay. Postprandial test insulin levels used less, by the way, can, after consuming a certain meal that's measured of glucose, then determine how the insulin is being released. Now, what all this means is that elevated insulin levels suggest the body is not responding to insulin, like type 2 diabetes, insulin resistance. Low levels of insulin condition could be type 1 diabetes or late type 2 diabetes. Now, you can confirm elevated or low insulin levels by doing a hemoglobin A1C, a glucose tolerance test, homeostatic model assessment, HOMA-IR, which tells you a little bit where you are, as well as a C-peptide to determine the difference between a type 1 and a type 2 diabetic if that's necessary. And you could use regular monitoring of insulin levels to see how your diet, exercise, and nutritional program is working. Now, many women with PCOS have difficulty. They need to produce more insulin to handle the sugar levels. And this insulin resistance that's noted by the high levels, you'll see with weight gain in these patients and increased androgen production, meaning they'll get some more hair perhaps on their face, and potentially higher risk for type 2 diabetes and cardiovascular disease. So yes, it's an integral part of diagnosing and a wellness panel for patients and insulin level. And here's the takeaway that you should know, the summary of insulin levels, very simple. Number one, it should be done fasting, 8 to 12 hours. Number two, if it's elevated, think type 2 diabetes or PCOS, polycystic ovary syndrome, which then you can go forth and take a look into other things like doing intravaginal ultrasound and looking at the ovaries to see if there is cysts on the ovaries. And of course, the resistant diabetes or late type 2 diabetes if the level is low. And that's your summary. And you should be able to use that test quite confidently. If you have any further information that you like, just write me at DrMitch at MitchGhen.com. That's DrMitch at MitchGhen.com.